result in impairments in reading, writing, speaking, and listening. It does not affect the person's intelligence. Overall, aphasia will change the individual's life forever. Types of aphasia.
Global aphasia is the most severe form of aphasia. These individuals cannot read or write. They produce few recognizable words and understand little or no spoken language. The site of lesion is the left hemisphere. This is a picture of the left hemisphere. Broca's aphasia. Broca's aphasia is a non-fluent aphasia. These individuals are agrammatic, which means they have a loss of function words and poor grammar. Their content words, which are nouns, are preserved, but they have difficulty with sentences due to poor grammar. Repetition is poor. Site of lesion is Broca's area. The dark blue area is Broca's area. Transcortical motor aphasia is also a non-fluent aphasia. These individuals have good repetition skills, difficulty with spontaneous answers to questions, and impaired listening skills. The site of lesion is the watershed region between the middle and anterior cerebral arteries. This is the watershed area on the left. Wernicke's aphasia. Understanding meanings of words is impaired. They often use nonsense words. Producing connected speech is normally not affected. Although it's referred to as a fluent aphasia, it is far from normal. Reading and writing are often severely impaired. Site of lesion is Wernicke's area. Wernicke's area is the yellow area.
In anomic aphasia, they have the persistent inability to supply the words for the very things they want to talk about, particularly nouns and verbs. They have difficulty with finding words. Speech is very fluent grammatically, but output is vague, often talking around their target word. They often experience frustration and understand speech and often read very well. The site of lesion is inferior temporal lobe below Wernicke's area. This is the area below the green and the yellow. Transcortical sensory aphasia is a fluent aphasia where more than 4 words is spoken in a phrase. They have good repetition and poor listening skills. They experience the inability to name pictures and objects, and echolalia, which is the repetition of what they have said or heard. The site of lesion is the watershed area near Wernicke's area. In conduction aphasia, the prominent impairment is with repetition. They have difficulty with word finding, repeating phrases, especially as the sentence complexity increases. The site of lesion is between Wernicke's and Broca's area.
Etiology. Stroke, the #1 cause of aphasia, caused by blockages or disruption of blood flow to the brain. Too little or too much blood to the brain. Traumatic brain injury, or TBI, is when there is compression within the brain, blood leakage in the brain, increased pressure, which may obstruct circulation. Tumors, rapidly growing mass in left hemisphere that can cause brain damage. Location of tumor is crucial. Damages brain tissue.
Ages. In children, there are several medical complications that can lead to stroke, including intracranial infection, brain injury, vascular malformations, occlusive vascular disease, genetic disorders, tuberous sclerosis, and Marfan syndrome. In young adults, some risk factors would include drug use, alcohol abuse, pregnancy, head and neck injuries, heart disease, infections, and links to genetic diseases. For adults 55 and over, stroke is the #1 cause of aphasia. Stroke risks increase with age. For each decade after age 55, the risk of stroke doubles. Some risk factors would include hypertension, heart disease, diabetes, obesity, and heavy cigarette smoking.
Progression. The greater the severity, the worse the potential outcome may be. Throughout their lifespan, some individuals continue to progress, while others will plateau. Language recovery depends on the size of the lesion, age, and overall health of the patient. Speech and language therapy can help to regain some of the patient's speech. Created by Kayla,
Maggie,
Kelsey,
Sarah,
and our camerawoman Taylor.
Aphasia. It's never too late